The member from Kenora-Rainy River.
Thank you. My question is to the Minister of Health. Speaker, a month ago, I wrote to the Minister of Health, urging her to address the ongoing problems in primary and emergency care in Rainy River. I invited the Minister to come to my riding, sit down with health providers and community members, and finally come up with a solution that will work in the long term. 1 month later, and I have not received a response, and we are now facing a crisis. I have a copy of that letter and a new one that I will ask a page to hand deliver to the Minister of Health. The only doctor that is left in Rainy River is leaving his position as of April, after concluding, and this is a quote from him, that the Ministry of Health has no interest in fixing the problem. Speaker, why is the Minister forcing Rainy River into a crisis situation rather than working with us to solve the issue?
Thank you. Minister.
Thank you. Well, thank you for the question, and I welcome the invitation to come to Rainy River. What I do want to say, Speaker, is that we are aware of the emergency department issues in Rainy River. We're working very hard to ensure the coverage that is required. I do want to say that I'm very happy to know that the emergency department is now fully covered until April 5th. The member opposite has raised issues before, worried about coverage over Christmas holidays, for example. We fixed that, Speaker. We've now got coverage until April the 5th. I can tell you, Speaker, that we are working hard to ensure that there is access to care throughout the province, and that is part of the reason, Speaker, why we are bringing primary care under the umbrella of the LHINs. It is at the LHIN level, the regional level, Speaker, that primary care can be delivered.
Thank you. Commentary.
It's a systemic issue. It's not a problem at the LHIN level. It's a systemic issue. Speaker, this doctor has been sounding alarm bells for years. The situation for family doctors in communities like Rainy River is untenable, and it means that we are unable to recruit permanent family doctors. The Minister knows all of this, yet she keeps hoping that the problems will somehow magically disappear. Well, they won't. Speaker, the system as it now stands is broken. Will the Minister commit to working with me and healthcare officials to create a strategy that works for Rainy River and other northern communities?
Good question. Minister?
Speaker, what I can tell you is that this government has been very focused on ensuring that there is health coverage in the north. That is why we opened a new medical school in the Northern Ontario called the Northern Ontario School of Medicine. Speaker, it is now graduating doctors that are from the north who want to practice in the north, and they are training extraordinarily fine physicians. The people of Northern Ontario are the beneficiaries of that investment today, and they will continue to be as this Northern Ontario School of Medicine continues to graduate physicians who specifically want to work in the North, Speaker. The hospital in Rainy River is continuing to work with Health Force Ontario to ensure that there is adequate coverage. The member opposite and I want the very same thing, and that's for there to be coverage for the people she represents. We are taking steps to do the very best we can to ensure that happens, Speaker.